seminal vesicle is function. Seminal vesicles are, this is a sac that contains the seminal fluid, that contains the seminal fluid. This seminal fluid, while it is in the seminal vesicle, there is no sperm in it. Sperm forms in the testis. They are stored in the epididymis. But when they get discharged, both seminal fluid and the sperm joins together through the ejaculatory duct and it discharges together. So now, this seminal fluid is produced by a sac known as seminal vesicle. So now, if this is a seminal vesicle, this seminal vesicle is it's a duct system. It has the capacity to produce lubricating fluid that is known as seminal vesicle, seminal fluid. So these are the cells produce fluid, and this fluid rich in fructose, and this fluid is alkaline in nature. This seminal vesicle has a duct, we call it seminal duct. This seminal duct will join with the vas deferens. So this is vas deferens. When they join together, its name is ejaculatory duct. Ejaculatory duct. And this ejaculatory duct will join with the urethra. Okay, I just draw in one-sided, and this part whole thing is in the prostate gland. This is inside the prostate gland. Now question that why do I need to know this? Because if the prostate gland is enlarged, prostate gland has a tumor, it can compress the urethra, it can compress the ejaculatory duct, right? So when it compresses bilaterally onto the ejaculatory duct, so then patient may complain of serious pain during the act of ejaculation, and patient may suffer from infertility. Okay, so now seminal vesicle, I was talking, the seminal vesicle has seminal fluid that is alkaline in nature and it contains fructose. What is fructose? It's a carbohydrate, it is an energy for the sperm. A sperm needs energy coming from this fructose. Sperm cannot survive in acidic media. That's why it is alkaline, God gifted. That's why you notice that during the act of activities, so there is little discharge or lubricate, makes the passageway more alkaline so that sperm cannot die. Okay? And again, in the vaginal cavity, the media acidic because of the lactobacillus. There are a lot of bacillus in the vagina. So they make the environment in the vagina is acidic. So seminal fluid is alkaline and prostatic fluid is also alkaline. Prostatic fluid, prostatic juice. It has a little duct and it connects with the urethra. And it releases that prostatic juice into the urethra. So that is alkaline. Then seminal fluid is alkaline. So they merged with the sperm. Then sperm comes through the urethra. Urethra environment is acidic because the urine is acidic. Sperm can die. That's why sperm comes with the alkaline fluid, seminal fluid and prostatic fluid. And when it is discharged in the vagina, then again acidic, but the alkalinity of the seminal fluid and prostatic fluid will make the environment alkaline. That's why adequate amount of seminal fluid is needed for swimming of the sperm. Okay, so that is very important, that seminal vesicles. Normally these seminal vesicles, it can be up to say 7.5 centimeters, 3 inch, when it is completely full. That's why if somebody needs an ultrasonography to see the seminal vesicles, he will be instructed be abstinence 3 to 5 days. So that seminal vesicle will be full. So you can see 2 seminal vesicles hypoechoic, like a bow tie on both sides of the prostate gland. It is posterior to the bladder. Seminal vesicles are posterior to the bladder. You can say posterior and inferior to the bladder. And it is above the seminal vesicles, above the prostate gland. And sonographically we can see posterior to the bladder. Okay, so this is seminal vesicles, and prostatic fluid functions. It is alkaline in nature and it helps the sperm for survivability. Okay. prostatic fluid. It is alkaline in nature. Alkaline nature, and it helps for motility, means movement, motility, helps motility of sperm. Okay, we'll discuss more about the prostate gland later, but know that this prostatic juice, alkaline, seminal fluid, and the sperm will come all together. Okay, so now little more about the anatomy of the epididymis and the scrotal sac. So this is scrotum, this is, say this is right side, and this is left side. And there's a partition. This partition name is median raphe. Median raphe, it is the midline partition making the whole scrotum into two compartments. And each compartment has testis and epididymis. Epididymis and testis. Now I will draw the scrotal cavity. So scrotum has scrotal cavity. So when the tunica albuginea covers the testis, it covers the epididymis along with that. From the back of the or posterior part of the testis, this colorful line, that is the layer, it goes back onto the wall, scrotal wall, and it covers the scrotal wall. Okay, so this is scrotal wall. So now what happened then? There is a potential space. This is called scrotal sac. This scrotal sac is a potential space between, this is visceral layer of tunica vaginalis and this is parietal layer of tunica vaginalis. So this is the scrotal sac. Where are the sac located or boundary? So boundary is the visceral layer of tunica vaginalis. Actually this is firmly attached with the tunica albuginea. And other layer is along with the scrotal wall. This scrotal wall has a 5 layers. So this is scrotal wall. This scrotal wall has 5 layers. What are those layers? You need to know. Number 1 is skin, most outer skin, and it has a hair follicles here. Number 2, cremasteric fossa. Actually this is the muscle, thin muscle, cremasteric fossa. Number 3, external spermatic fossa. Let me check. Tunica, sorry. Okay, number 1 is skin. Number 2 is a dartos muscle. And number 3 is external spermatic fossa. External spermatic fossa. Number 4, the cremasteric fossa. Cremasteric fossa. And number 5, internal spermatic fossa. And the innermost is the parietal layer, of tunica vaginalis. Okay, so these are the 6 layers: skin, dartos muscle, and this dartos muscle contracts the scrotum. That's why scrotum gets relaxed, bigger and squeezy. external spermatic fossa, then cremasteric fossa. This cremasteric fossa is made of by the cremasteric muscle. Okay, that cremasteric muscles has a role to pull the testis into the scrotum. Then internal spermatic fossa, and then parietal layer of the tunica vaginalis. So these are the layers of the wall. Why do I need to know this? Because the scrotal wall thickness is very important. It should be less than 5 millimeter. Scrotal wall thickness less than 5 millimeter. If it is greater than 5 millimeter, then we have to understand there might be edema, there might be infection, there might be a disease on the skin. A lot of people have psoriasis, eczema in the scrotal wall. Okay, so we measure the thickness. I will show you how we measure. But this is testis and the scrotal sac and the scrotal layer. So now epididymis. Epididymis has head. It is a comma shaped. Epididymis is a comma shaped. They ask this question, where is it located? Posterolateral of the testis. Posterolateral of the testis. And it has a head, it's a body and tail. Head, body and tail. The head is superior to the upper pole. Superior to the upper pole. And the tail is the narrowest part and is going down towards the lower pole. And the body is in the middle. Body is in the middle. The question, the why epididymis, why you are attached with the testis? What are you doing there? Then understand this. So this is testis. From the testis, remember the efferent ductules. What is this efferent ductules? These are the seminiferous tubules. These are the seminiferous tubules. Seminiferous tubules was hundreds and thousands of seminiferous tubules. It's all over the testis. But here they are converged and finally say 10 to 15 tubules came out as a efferent ductules. So this is efferent tubules. These efferent tubules will go inside the look at here.